everyone, so I'm here to show you the Ohio CNA Skill, dressing the dependent resident. First, you're going to start with hand hygiene. You're going to rub your hands with hand sanitizer until dry. Next, you're going to knock and introduce yourself and explain the procedure. Hi, Mrs. Smith. My name's Davina. I'll be your CNA today. We're going to be getting you dressed.
Okay.
I'm going to go ahead and provide privacy by closing the privacy curtain. I'm going to raise the bed to a comfortable working height, which will be mid-thigh to waist. Mrs. Smith, we're going to go ahead and raise the bed up a little bit. I'm going to move your call light out of the way just for a few minutes. For this skill, you will need a bath blanket. You will need a t-shirt or blouse, the pants, and a pair of non-skid footwear. The test observer will inform you of which side will be the resident's weak side, and this will be important to know. When you are dressing the resident, you will always undress the unaffected side first, and you will dress the affected side first. So let's start. Okay, Mrs. Smith, I'm going to take your bath blanket here. Place this over you. During this skill, you are not allowed to expose the resident. You have to keep them covered. I'm going to go ahead and move these blankets here just a little bit out of the way. And that's going to help when we are dressing Mrs. Smith. Okay. I'm going to go ahead and walk to the other side of the bed so I can undress the unaffected side first. I'm going to go ahead and guide Mrs. Smith's hand out of the gown. If at any time you accidentally expose the resident, you will just need to apologize and then cover them back up. I will then place Mrs. Smith's gown in the designated container. Next, I will be dressing Mrs. Smith. Mrs. Smith, do you like your shirt?
Yes.
Perfect. Mrs. Smith, we're going to put this over your head. I'm going to go under the blanket and place the shirt under it. And now I am going to be guiding Mrs. Smith's hands through the sleeve of the shirt. Okay, and go and place your arm back down. Okay, Mrs. Smith, I'm going to go ahead and put this hand, I'm going to guide that as well through this sleeve. Okay. Mrs. Smith, does that shirt feel comfortable?
Yep.
Okay. Next, I will be dressing Mrs. Smith with her pants. Mrs. Smith, do you like these pants?
Yep.
Okay. After you have got the pants on over the feet and you're going up the legs, when you get to about the thighs and waist, that's when you can start to have the resident either move side to side or thrust up. If you do decide to have them move side to side, you will need to make sure that the side rail is up. And that needs to be up on the side that you are going to be turning them to. Okay, one more thrust up. Let me take a peek. I think we might have it on all the way. Oh, yep, let's fix that little spot there. I want to make sure that the pants are not folded or bunched up. You need to make sure that your resident is comfortable. Mrs. Smith, does that feel okay?
Yep.
Okay, perfect. I'm then going to apply the non-skid footwear. Okay. After I've placed the non-skid footwear on, I am going to start to remove the bath blanket. There we go. The bath blanket will then be placed into the designated container. I'm going to lower Mrs. Smith's bed to the lowest position. I am going to open back up the privacy curtain, hand Mrs. Smith the call light. Mrs. Smith, can I get you anything else?
No.
I'm going to perform hand hygiene. My skill is complete.